talking to me, or they'll hang out in the corner of a room and being able to watch the whole room. They really can move out of their body. It is kind of cool to be able to do this. Pardon? It's not withdrawal. It's kind of, it's like you being able to see you sitting here from someplace else. I don't recommend it, but if you are terrified, it's kind of a cool thing to do. What did you say, sir?
Out-of-body experience.
Out-of-body experience. You got it, where you can see your body. We hear about that when people die and they say, I saw myself on the operating table. That is perhaps an experience of depersonalization that happens because we are so terrified that we literally move out of ourselves and we shift our shape. There's also disassociation time travel, where we really are separate from our experience with little or no recall. So many kids that I have worked with who, after a big fight, you ask them about the fight and they say, what to you? I don't remember. And we say, what do you mean you don't remember? They don't remember. It could be they were disassociating. It could be they were triggered and disassociated. I think the kids in our system are a highly traumatized population. There has been research on trauma, and any of you familiar with the ACEs work? Some of you I know are, some. I was rereading my notes yesterday on ACEs. I reread an article. This is the biggest public health study in the United States of America that the fewest amount of people know about. This has been going, it started in 1995. 17,000 people have been followed. It's going international. And what it's looking at is adverse experiences in childhood and what happens when people have adverse experiences in childhood, what happens to them as adults. And how this study started, it started as what's called a retrospective study. They took a bunch of adults and they asked them about their childhood. And they found out that there were 10 factors that predicted later health. Has the child experienced emotional abuse, physical abuse, neglect, lack of support within the family, sexual abuse, loss of a parent, domestic violence, substance abuse, mental illness, incarceration of the parent before age 18? Any of those from any of the members of the family? Okay? Guess how many people have experienced of the study one of these? 2/3 of you, we're going to guess what the original population was. 2/3 of the original population experienced one. Guess how many you needed of this before you started having, as an adult, serious consequences?
1.
No? 4. 4. But then their population was an interesting population, because my guess is if we were to do that study here, we would get things slightly different. The original population, the mean age was 55. They were white. Most of them had college. And they found this much prediction in that population. Imagine if we did it just on the people in this room. What they're seeing, and what one of the things the researchers said, is the reason why this study has not gathered more steam is because the implications of the study are not medical. The implications of the study are not psychological. The implications of the study are what? Social. Political and social. That if we're saying if 4 of these things happen in our upper part of our population, and that predicts serious consequences. The first consequence for this population that was predicted was alcoholism. If you had 4 more of these things going on in your life before 18, the was chronic obstructive pulmonary disease, COPD. Because having trauma relates to physical health and emotional health. The third thing was depression. The third thing, not the first thing, interesting. The third thing was depression. The fourth, I'm not going to go down the whole list, was having a health-related disorder. Pretty broad category. But we know that trauma early on relates to the physical well-being of the adult and relates to the emotional well-being of the adult. When we look at current prevalence of diagnoses, and these are all over the place, they came from different sources, so they're not going to line up evenly, but I found it kind of hard to get actual numbers of different diagnoses for adolescents. In 2004, as rated by parents on a test that actually has a lot of research behind it, over 10% of adolescents were seen as having, by their parents, behavior or mental health disorders. 1 in 5 adolescents experienced emotional distress. Males were seen as having more mental health problems than females. Guess what? Lower income kids have more mental health problems than higher income kids. That may have something to do with the ACEs research. Learning disabilities, ADHD, ADD, the current thing, it's like, you got to be on Ritalin. Now the adults I'm working with, they all have to be on something, right? Because they can't attend. Challenges in learning, it's about almost 10%. By the way, a lot of challenges to learning can be dealt with by behavioral means. It just takes time. It takes time, structure, and a plan. I'm not saying all of them, but a lot of them. More than 1/2 of the youth who drop out of school have a diagnosable mental health problem. Substance abuse disorders, this one I found interesting. About 8% of the kids had criteria, and this particular study showed more females than males. I thought, well, yeah, we are catching up, isn't it? Just where I wanted to be. Not in income, but in substance use. There we go. And eating disorders, which use of diet products and so on. More females, but quite a few males. This tends to be something under-assessed in males, by the way. Concerning behaviors, accidents, suicide, homicide, common signs of mental illness in adolescents, we know it's in your handout. Even though we've been progressing in this direction, even though ACEs has been taking us here, there's been a small splinter group out here. Vandal Cope, somebody by the name of Judy Herman, Bruce Perry, have been talking about something called complex trauma. And complex trauma is the impact of multiple abuse sustained by a child. No diagnosis for it, by the way. We just know it happens. We know it happens, we know it affects attachment. And what is attachment? This is all the stuff about it. What is attachment? Intimacy. It's my ability to connect to you. That's attachment. And trauma affects people's ability to connect. Affect regulation. Where is my mood? Am I up? Am I down? Am I ready to knock you out? Am I ready to withdraw? It affects our biology. We've seen that from the ACEs work. Van de Kolk and his group are also talking about the biology, including that what will happen when we are traumatized is we somaticize. Those people who get sick all the time. I have one client I'm seeing, whenever she has a crisis, she gets flu. I don't think she gets flu, I think it's trauma. And it comes out physically, but she'll run a fever. She'll be throwing up. She can't go to work. Disassociation, key thing. Traumatized, behavioral problems, key thing. If you're fighting, you're going to be seen as having behavioral problems. Cognition. When people are traumatized, guess what it's hard to do when you're a kid? When you're traumatized, it's hard to learn. Doesn't mean you can't learn, it just means it's a challenge. You may not feel good about yourself if you've been traumatized. It may affect how you connect with other people. We need to be trauma-informed in the sense of looking at what it is we're doing with people. We need to ask them not just what's wrong with them or think what's wrong with them. We need to think what's happened to them. We need to think who they are. We need to get stories from people that are about the context of their lives, not just about the list of their symptoms. We need to be thinking really about whole sectors of our adolescence, about how are we going to deal with the trauma, not how are we going to deal with the anger, not how are we going to deal with the learning problem. We need to think about how we're going to deal with the trauma. We need to help our kids learn to deal with their triggers, which is what my workshop will be about this afternoon, and learn to self-soothe. Our kids are already doing that. They're getting high. How else can we teach them to do that? 5 minutes. We need, and the other thing is our research is at a point where we actually kind of know what to do. We know how to teach kids grounding techniques. We know how to teach kids self-soothing techniques. And our research is showing that when we teach techniques, when we have what we call reparative and restorative experiences, it actually affects the brain wiring. We rewire when we get new inputs. Just because someone has been traumatized as a child does not mean they can't lead a happy, healthy, well-adjusted adulthood. They just go by it a little bit differently. So thank you very much.